So we're going to start with the skin and bone set. We're going to start with first short answer question A. Ian, would you like to go first?
All right, so you are called to assist the BLS unit, which was dispatched to an anaphylaxis. Upon your arrival, you see an EMT drawing up epi from a vial into an insulin syringe. The EMT states that he had already given one 0.3 milligram dose to the patient with no improvement. What actions would you take to assist the patient after the call, and how would you explain your rationale to the EMT? What actions would I take to assist the patient? Well, I'm assuming this insulin syringe is too short for the dose, so it's probably sitting in the fat doing nothing.
Right.
So I would change to a longer needle and give it IM. That's how I would assist the patient. And then I would explain that exactly what I just said to the EMT. I don't know where he put the dose. I'm assuming he tried to put it in the correct place, but who knows?
Yeah. So what I was trying to get here, right, is exactly what you were saying, right? Insulin syringe will have shorter needles, usually less than 1 inch. And the intention of that is to go into the fat, right? The subcutaneous tissue, the fat tissue. Why? Because we want slow delivery of the insulin. But IM injections are directed at the muscle, right? If you look at the videos for the skin and bone chapter, I have a diagram shows the length of the syringe and where it's going, right? So for you to get into the muscle, you have to have a longer needle, usually greater than 1 inch for an adult person, and you have to penetrate past the subcutaneous fat. So if there was no improvement, perhaps the medication is in the fat, right? And it's not exerting as much of the effect. Why? Because in the muscle, we know there's good active blood supply and there will be good uptake of the medication and it becomes systemic. Once it becomes systemic, I will see those effects on the patient. So it's very important to inspect your needles, to inspect your syringes, select the appropriate size needle for the procedure you're going to perform. So if you're performing IM injection, make sure you select the appropriate gauge and length. What you can use, and I urge you to do, is whatever place you work, find the brand names of needles and syringes. Maybe it's BD, as I showed you. Maybe it's another brand. But once you find the brand name they use, go to the website. They usually all have instructions, provider instructions, and they will say, for IM, for adult person, this is the length and this is the gauge. For pediatric, this is the length, this is the gauge, because your protocols do not specify that. But if you give it in the wrong location, you're not going to get the effects you desire. So this is why I was getting it. Sometimes you may have very obese patients and they have a lot of adipose tissue. And in those cases, you may even have to select a needle that's 1.5 inches in length to get to the intended site. I also showed you pictures of IO needles, right? Intraosseous needles. So I have been to calls where the needle was placed into the fat, not to the bone, because the person was very obese and the needles was selection was shallow. And when you test it, you have no marrow return, so you're in the fat. So do not give any medicine through it, right? So that's good. Ian, that's good. B, let's do next. Go ahead, Milan.
You're called to do a standby at a house fire. During your standby, firefighters bring out a patient that appears to have sustained first-degree burns to both upper extremities and second-degree burns to the chest and abdomen. For your fluid resuscitation formula, you need to obtain the total body surface area for the burn. What percentage of TBSA would you employ? Explain which functions of the skin may be compromised to the extent of this patient's injuries. So this would be 18%, considering that the second-degree burns are only on the chest and the abdomen. We're not calculating the first-degree burn into it. And then functions, first of all, the protection will be compromised. The hypothermia might kick in because of the surface that was affected. And I'm also thinking that it might compromise a little bit of breathing, considering considering that it's covering chest and abdomen, so the extension of the skin with the extension of the chest might be, causing pain and impairing the breathing rate. They might turn into shallow respirations.
So I think I got most of it, but some of it you were breaking up. But I will. I think I heard everything correctly. So here they sustained first-degree burns to both upper extremities, right, and second-degree burns to the chest and abdomen. Chest, abdomen being 18%. But the reason why we don't count the upper extremities is because, as I said, right, first-degree burns do not get averaged into the formula, right? Whatever one you're going to use for that, the Parkland formula or modified Parkland. So the first degree burns, if you do not have blister formation, do not get averaged in. Second degree burns with blister formation and onward down, third degree and so forth, will get averaged in. So 18% is correct. What functions may be compromised? So the functions of the skin that burn may compromise. First of all, you may get infection, right? So the integrity of the skin is no longer intact. So infection, that's why we tell you to employ sterile sheets, right? Thermoregulation may be compromised. So that's why we want to keep them warm. If they have extensive burns, we do not want to soak those sterile dressings. Why not? Because soaking them in saline, even though it's sterile, you're going to drop their body temperature. So we want to thermoregulate, we want to maintain them. Sensation may be lost, right? Sensory. So depending of how deep the burn is, if you remember your layering, right? Epidermis, dermis, right? Then you go down subcutaneous tissue, muscle, right? All the way down to the bone. So depending on where the burn is, how extensive the burn is, maybe they got to the point where the nerve bundles are affected. So sensory function can be affected. What you said about breathing can also happen if you have circumferential burns. It means around the area. I showed you pictures of patients who have circumferential burns to their chest and back. And if that occurs, they may need to get ascherotomy. It's basically they cut the skin open in order to facilitate, right, them to breathe, so the skin is not so constrained. The other thing you always worried about airway, right? Airway. So airway, we always have, if they inhale superheated gases, you may have edema, right? Formation in the airway. And then you may on the skin, right? This is not per se skin, but we just learned this stuff, right? Anytime you're dealing with house fire, you always got to be on the cognizant of carbon monoxide and cyanide exposure. So that could be potential problems if they have too much carbon monoxide. They will not get the exchange. But for this purpose, 18% is the correct, right, for total body surface area. And in the integumentary system, infection, thermoregulation, sensory control would be affected. So good. Next, we're going to start with multiple choice. The first part of it is going to be integumentary system. Integumentary system, essentially the skin. Let's see who we got. Let's do Angel. Angel, you have your hand up. Let me make it smaller so you can see.
I didn't, but I'll answer it. See if I get it.
Okay.
Each of the following is a function of the integumentary system except D.
D, right? You said D, right? Yeah, D is
right. Yes, D.
Correct. Vitamin C, we don't synthesize. We get that from the diet and supplements, I guess. Vitamins. You guys remember like disease scurvy, right? Scurvy, lack of vitamin C. So skin skin does not synthesize vitamin C. We get it through a diet. It's essential for us. But all the other functions the skin does, right, has protection, it has excretion, maintenance of body temperature, thermoregulation, sensation, as we just talked about. So all of which is accept, right? So the accept is the synthesis of vitamin C. Good. Let me leave this picture up so you guys can see it. Let's do number 5. Let's do Lindsay.
Which layer is the primary barrier against environmental hazards? A.
A.
The epidermis.
Yeah, that is correct. Epidermis is the first layer. A is the correct answer, right? This is the layer. Remember, your skin is your first layer of protection, right? So if you, this is another thing. Well, we wear gloves no matter what, right? But know that if you have a break in your skin, right, you want to be very cautious, right, if you make contact with anyone with their secretions, with their blood. So protect with the, your skin with Band-Aid. Definitely wear gloves, and the first layer of the skin, the epidermis, is the protection layer. That is correct. All right, so good. We get to number 16. So Jessica, would you like to do 16?
Sure. 16. All of the following are characteristics of the epidermis, except that it's not vascularized. So E.
Yeah, that is correct, right? So all the following are epidermis, multi-layer, flexible, self-repairing, UV protection. You see in this diagram, right, the vasculature is not at the portion, right? The vasculature starts deeper down, right? So the top portion does not have that. So 16, E is the correct answer. Number 24, let's do Adam. Adam, would you like to go?
Yep, just making sure you can hear me.
Yeah, I could hear you.
All right, just make sure my headset's a little funky sometimes. 24, cyanosis signifies that a patient has D, oxygen-starved skin.
Yeah, excellent, right? We talked about the cyanosis is basically when you have desaturated hemoglobin, right? So D is correct. Oxygen-starved skin is the correct choice. All right. Next one is number 30. Let's do Edwin. Would you like to go?
Yes. 30, right?
30 is the one, yes.
Yep. What is the most common type of cells in the subcutaneous layer? I put B.
B is correct, right? Adipocytes, right? So we said sub-Q, right? Sub-Q is the fat, and the fat is the adipocytes. That is correct. All right, number 33. Let's see. Curtis, would you like to go?
Yeah. If the epidermis, dermis, and part of the hypodermis are burned, it is classified as a C, partial thickness burn.
So when you get to the dermis layer, right? When you get to the dermis layer, so you're basically going forward. Let me just go back to this picture, right? So you are going here, right? So when you're getting to this level, you are a little bit deeper than the partial thickness. So at 33, you are at full thickness, right? Some books I know in my lecture, some books do have 2 divisions for partial. They'll say they will have superficial and deep. But some books, and this book in particular, they basically subdivide first degree, second degree, and then which is partial thickness, and then you have full thickness. So this for 33 is full thickness. All right. So now we're gonna switch from the skin portion of it, right, which was this part, integumentary system. The next part of it will be the bones and bone structure. Make sure you guys have the right pages set up, otherwise we are going to be confused in terms of what you guys wrote. Next time I'll try to number them so that it might be easier to follow. So bone and bone structures, number 1. Let's see who we got. Priscilla, would you like to go?
Yeah, that's fine. Number 1, which of the following is not a function of the skeletal system? I believe it's E. It doesn't regulate temperature.
That is correct, right? So that the bones do not regulate your temperature. That is correct, right? I think that was an easy question. Number 3, see, we got.
Can I go?
Sure, go ahead, Brendan.
Sorry. The most abundant mineral in the human body is calcium.
Calcium is correct, right? Remember, I was talking to you about the parathormone. If there's lack of calcium, right, normal, remember I said 911 is what you call milligrams per deciliter. That's your normal range for calcium. And if you're below 9, let's say 8.5, you have hypocalcemia. Above 11, you have hypercalcemia. If your body senses you have low calcium, parathormone will secrete parathyroid hormone, and it will basically break up your bone tissue, releasing calcium. On the other hand, if you have too much calcium, calcitonin will be secreted, and they'll reabsorb the calcium, less excretion in the kidneys, right? And reabsorption of the calcium as needed.
Hey, Nick, I got a question.
Yeah.
It's on topic, but a little off. I just wondered, during cardiac arrest, when medics push calcium, sodium, epinephrine, and everything, I know it's in the protocols, but how do you know what in the order of which you're pushing, and why do you push those? Well, I know why we push those, but the order of those.
So you're specifically referring medical control options, right? In the protocol. So
That's correct.
Yeah, medical control options. So in the medical control options, you have the listing of those drugs. Not all of those drugs get to be pushed. Medical control options is basically if you have a particular situation that you believe the person or the patient is having. For example, with response to calcium, let's say the patient is on calcium channel blockers, and you believe they overdosed on them. They took too much. You come to the room, you see their bottle of diltiazem, right, is empty, or some other calcium channel blocker that they're using. So you may call medical control, and you could request for calcium as to counteract, right, the calcium channel blocker overdose. So you want to counteract it. So your medical control options for your cardiac arrest, a good mnemonic to remember is a big man can. So it's repeat of amiodarone, it's bicarbonate, right? Bicarbonate for acidosis, mag sulfate for white complex tachydysrhythmias, and calcium chloride for calcium channel blocker overdose. So the way medical control options work is you don't call the doctor and say, "Doc, I don't know what's going on. It's eeny, meeny, miny, mo." The way it works is you call up medical control and say, "Hey, doctor, we're on the scene of cardiac arrest of a 70-year-old male. I see there's open pill bottles of diltiazem. I strongly suspect this calcium channel blocker overdose. We are delivered, X amount of shocks, gave our standing orders, amiodarone. I'm calling for orders of calcium chloride because we believe there's a calcium channel blocker overdose." Or you could say, we believe this person is having, acidosis. A drug I would like to give is bicarb. So it's not like you're asking the doctor what to give. You're giving your presentation and you're stating what you like to give and your reasoning behind it. Does that answer your question?
That actually does. It's more dependent on what you got and what you see and what do you. Yeah. I got you.
In some cardiac arrest situations, I may not push any medical control options. In some of them, I may request 1 or 2 depending on the situation. So it's not you give all of them. It depends on the situation. Yes. That's why it's important to know your medications, right? All right.
Gotcha. Thank you.
No problem.
You said the drugs were A, B, M, C. What were they again? Amiodarone. What else?
Yeah. So in your medical control options for your pulseless VTAC or VFib. So the medical control options is these drugs. The way I like to remember them is it's a mnemonic that I use. It's called a big man can. You could make up your own mnemonics. It's easier for me to remember. A is amiodarone. It's an antiarrhythmic medication, right? B is sodium bicarbonate, right? It's basically this medication we were talking about, right? Sodium bicarbonate. You're giving it in cases of suspected acidosis, metabolic acidosis. So a patient had prolonged downtime. Then you have M for mag sulfate. Mag sulfate is usually given in cases of torsades de poids. It's a white complex tachydysrhythmia. Oftentimes, alcoholics have it because they have lack of electrolytes. And then C is calcium chloride or suspected calcium channel blocker overdose. So those would be your medical control options. All right. Get to 5. Would you like to do 5 since you asked that question?
Sure. Which of the following bones is classified as irregular in shape? E. Ulna?
So ulna and radius ulna are usually long bones, right? We do long bone splinting, but irregular, right? And the shape is C. It's the vertebra, right? Remember, there was a slide in the lecture presentation where I had all the bones. Like for example, sternum was the flat bone. You had the femur, right? The radius ulna with the long bones. So go through it, take a look. There are some questions on the quiz that will ask you what type of bone to identify. So make sure you know the 5 types of bones, right? Which is regular, which is long bone, which is flat bone, and so forth. All right. Number 6. Let's see who we got. Brenda, would you like to go?
Sure. The carpal bones are examples of short bones.
Short bones is correct, right? So this is the type. So this is the type of questions you may or may not see. All right, number 7. Let's do Edwin. Edwin, are you here? All right. Let's do AJ. Number 7.
Hello?
Yeah, go ahead.
Oh, sorry. I didn't realize I didn't realize everything was muted and my thing was off. A rib is an example of a long bone?
So actually, rib is an example of a flat bone.
A flat bone?
Flat.
Okay,
Look,
gotcha.
think about it on the shape, right? Sternum, the ribs. So long bones. What are the long bones? Long bones is your tib fib, your femur, right? Your radius ulna, your humerus, your long bones, right? The big bones in your arms, your legs, right? Sometimes the name, helps you to remember. All right. The next, no problem. Next one. Let's see who we got. Adam, would you like to go?
Sure. So we've got we're number 24, yeah?
14 for the bones.
14, sorry. Yeah. All right. The humerus is an example of a long bone.
Excellent, right? Long bone. That's what we were talking about. Humerus, radius ulna, tib fib, femur, right? All long bones. All right. 24. 24. Let's do Jessica, would you like to go?
Sure. The medullary cavity of bones contains periosteum.
So the medullary cavity, if you look at the diagrams, it actually contains the bone marrow, right? So sometimes pictures are better for these things, like giving the descriptions. But make sure you go back to the pictures. I have plenty of those. So the cavity itself, right, has the marrow, and that's what when we do the IO needle access, we will draw up, pull back on if this was my syringe, I'll pull back to see if I have a marrow return. So medullary cavity is the highly vascular network, and that's where the marrow is contained. All right, 26. Let's see. We got. Helmi, would you like to go?
The shaft of the long bone is called diaphysis.
Very, very good. Yeah. So the diaphysis, right, is the shaft. The epiphysis would be at the distal end.
In the growing part of the bone.
Excellent. Right. Good. 32. Let's see who we got. Sarah, would you like to go? 32.
Yeah. Cells that secrete the organic components of the bone matrix are called osteoblasts.
Yeah, that is correct. C is correct. Osteoblast is they create the bone matrix, they expand and they ossify. So osteoblasts is correct. Something I wanted to say here. There is medications when they give for cancer, right? They called vincristin and vinblastine, right? Vincristin, vinblastine, and as the name suggests, right? What do you think they blast? What do you think they destroy? They destroy, right? Bone marrow, right? So osteoblasts. So one thing to remember, right? When any patients who are on those medications for cancer, vincristin, vinblastine, they will be blasting their bone marrow, right? And osteoblasts may be, affected. So just something to keep in mind here.
Use it mainly in myeloma.
Yeah. 42. All right, 42. Edwin, are you back?
Sorry. Yes.
Go ahead. 42.
I chose the most abundant cell type in a bone is E, osteocytes.
Yeah, that's correct. The site means cell, osteo means bone, osteocyte, right, is the most abundant cell type, is correct. And number 43, it's the last one here. Let's see, we got John, would you like to go?
Sure. How would denaturing collagen from the bone matrix affect the physical properties of a bone? It would be more brittle.
Yeah. So remember, I said collagen. Collagen every 1, 2, 3 is glycine, right? So it was the glycine, and the reason why it's small, it cross-links very easily with the other collagen fibers, and denaturing collagen will basically make the bone more brittle. That is that is the correct choice. All right, now we're gonna move up to our joints. Let's see. Make sure you guys got the correct pages open again.
I could go.
Aaron, go ahead, Aaron.
A movement away from the midline of the body is termed abduction B.
Yep. So whenever you move away, take away, right? So if you get abducted, you could think of it getting abducted by aliens. If you get abducted, they take you away. And away from midline, that's correct. All right, next one, 41. Let's see. Ian, would you like to go?
41. Bending at the neck to look up at the stars would hyperextend the neck.
That is correct. And this is what you're going to be doing. Be hyperextending, correct. 56. I think this is the last question. Jessica, Jessica, I think you went. Let's see. Who we got?
I didn't go.
You go ahead.
Which of the following movements is a good example of, I don't know how to say that word.
A supination. So supination is like when you twist your palm up.
So B.
56 B, yeah, turning the hand palm upward. A good way to remember, right? If you're working on your biceps, right, you will supinate, right, to engage them. So turning your hand upward or palms up, and pronate will be the the other way, palms down. So this basically will conclude the set.